Okay, if you're one of those people who is struggling with trying to turn on your core, activate your pelvic floor, switch on your abs, then this is the definitive cueing guide for you to try and get it right for good. Now, I know it's hard, and in physio, we bang on about it all the time, about trying to get your core switched on when you're doing exercises for abdominals, or you're trying to work on stability of your spine if you've had a disc injury or surgery or just general back pain. But trust me, once you get it right, then you probably find it's like riding a bike. You've got it for good. So let's start off with the setup. You've got to make sure you're in neutral spine. So what that means is not into flexion. So you don't want to flatten your back. You can't have a flat back here. You can't have a back that's super arched up. All right. You need it in neutral, which is, think of halfway between flat and arched. You should be able to get sort of your hand in about halfway. That's how far curve. You shouldn't be able to get it all the way through. Now, when you're in neutral, you're going to have the best chance of activating everything correctly. Next thing you want to do is place your fingers. I would put 2 fingers, find the bony point on either side of the pelvis. Okay, so the ASIS, which is the front side of the pelvis here, you're going to put 2 fingers on each side. So for here, you'd go for the bony part. You'd also go down in an inch so you can actually feel what your transverse abdominis is doing. Okay, so that is going to be the easiest way for you to get some feedback, because otherwise it's pretty hard to know what you're doing. So it's very important that you get your hands in the right spot so you can get that feedback when you're doing it correctly. So what you aim for, if you look at here, now you as a patient won't be able to see this, but what you're going to aim for is, you can see the belly button here. What we're aiming for is this belly button to move a little bit south and a little bit down, not a whole ton down. Certainly not a whole ton up and not a whole ton down, but a little bit down and a little bit in. So the first thing you're going to do is what we call switch on your pelvic floor. Now what that means for most people is holding a wee. So here, what I want her to do is to think about feeling what's going on with her finger here, feeling what the tone is doing. She's going to start with her abdominals doing nothing. Okay, so it's absolutely soft here, right? What she's going to do is think about holding a wee, which is activating her pelvic floor. What she should feel is the muscle here, where her fingers are, just slowly tighten. Okay, she's not allowed to push it out. You push it out for me. She's not allowed to push it out like that. Okay, you see that? She's also not allowed to suck it in, so try and suck it hollow. She's not allowed to suck it right down and make a hollow abdominals here. What she's aiming for is to keep this flat. Okay, so think of like from her finger to the other finger, it's like a trampoline. At the moment, when she starts off, it's really soft. Then when she switches on her pelvic floor, she's aiming for a very tight sort of trampoline. What she's feeling, you can feel from these fingers, is a ground swelling. So imagine like the abdominals are coming up and hitting that. Okay, that's what she should feel like, or they are tightening where her fingers are. Now what you're going to see when she does it is what's happening with the belly button. So if you relax for me again, what she's going to do is she's going to just hold a wee. You watch what happens to the belly button. She's going to hold a wee. Can you see that? So it's going slowly down. That's exactly what we want. It's only a subtle movement, but what that's telling me is she's using the right muscles to do the job. She's not using her obliques and her rectus abdominis to do the job. She's using her pelvic floor. Now what she feels is this muscle here, and we can feel it here. It's a tight trampoline now. Okay, so her transversus abdominis around here is gone and switched on, and that tone needs to be about a 30% or 3 out of 10 if you like. So if you think of a maximum tone you could do of 100%, she's aiming for about 30% of that. So that's the first stage. Okay, there's a second part to this. Once she's got her pelvic floor on, she's got to keep breathing, so she keeps breathing up in her ribs. She's not to breathe down here, she breathes up in her ribs. And like I said, she's not doming, she's not tucking down. Then she needs to think about, imagine if she had a scar, like an incision scar from one finger to the other finger. So between her 2 fingers where she's holding, almost like across her tight line like that, all right? Imagine that's a scar. What she's going to aim for is to try and think about using the muscle she's just turned on, that trampoline muscle, okay, the transversus abdominis, she's just turned that on. She's going to think about trying to shorten the scar with that muscle. All right, she's still got her pelvic floor on, all right? Then from this one to this one, she's going to try and pull it inwards. Now what I want you to watch is, again, what happens to the belly button when she does that. You'll notice that she doesn't push out, she doesn't pull in, she just tightens it a little bit more. So have a look at this. So if you relax completely for me. Now let's watch this start from the start. Let's do the pelvic floor. So pelvic floor comes on. You'll see that belly button go down a little bit. There it goes. Okay, it goes this way. And then she's going to tighten the scar from here to here. You watch what happens. It goes even more. So now she's working really, really well at bringing on this transversus abdominis. She's keeping her pelvic floor on, and you can see that belly button is held in the right position because, hey, that belly button's attached to it, so it's getting pulled down into that position, all right? She's not hollowing out, she's not pushing out, and that's going to give her a very stable spine. So if you follow those cues, you're going to do a much better job at activating your core or switching on your pelvic floor, which gives you that foundation for spinal stability so you can move on and do other things like lifting and strengthening abdominals down the track. I hope that helps. See you next time.